Leader of the third party.
Thank you, Honourable Speaker. People are facing long healthcare wait times, struggling to secure family doctors, having critical services cut, and BC's most vulnerable keep slipping through the cracks. I heard from a constituent just this morning that her mammogram was cancelled because there weren't enough nurses at the hospital. In budget estimates, I asked the Health Minister how many workers are on the front lines of our healthcare system compared to the number in administrative or corporate roles. He told me that BC has, quote, one of the lowest administrative costs in Canada. Data from the Canadian Institute for Health Information tells a different story. Of the provinces, BC is tied with Saskatchewan for the second highest percent of the entire healthcare budget going to administrative costs at 2%. The provincial average across Canada is 1.87%. My question is to the Minister of Health. As Minister, he has added over $200 million to administrative spending. Can he point to any improvements to healthcare that have come from this increase in administrative spending?
Minister of Health.
Thank you, Honourable Speaker. Overwhelmingly, what we're doing is adding frontline workers. The member refers to primary care. After our new payment model with family doctors, we added 708 new doctors, net new doctors, in 9 months, Honourable Speaker. We had the record year for hiring new nurses, record year for hiring new health sciences professionals. Our HCAP program, which delivers frontline care and long-term care and hospitals and home support, is one of the most successful health human resources programs in history. The Canadian Institute for Health Information does review these questions. They say we have the third lowest administrative costs in Canada. That's what the numbers say, Honourable Speaker. And they show that the percentage of administrative costs in British Columbia has been reduced as a share of the budget since I became Minister of Health.
Leader of the third party supplemental.
Thank you, Honourable Speaker. I was reviewing the data this morning. Canadian Institute of Health Information comparing data across provinces right up to 2023. Since 2020, yearly increases in BC's administrative spending have been 11%, 9%, 15%, and 8%. I'm not sure which data the minister is referring to, but I'm looking at table D3 of the Canadian Institute of Health Information. Healthcare professionals report frustration with the growing burden of administration in the healthcare system. My question is to the Minister of Health. Does the minister believe that primary care in BC should be trusted to health professionals, or does he think that there needs to be ever more bureaucracy?
Minister of Health.
Honourable Speaker, since 2017, we've added 32 new urgent and primary care centres, direct services for people, added 1,800 FTEs to primary care networks. There's 77 of them across BC delivering services everywhere. That's doctors, that's nurses, that's nurse practitioners, that's allied health workers, Honourable Speaker. It is true, Honourable Speaker, that we have repatriated jobs in healthcare, and I am proud of that, Honourable Speaker. I am proud of that. People who worked in contracted positions before, who would work a lifetime in public health care without a pension, Honourable Speaker. They've been repatriated back to the public health care system. Honourable Speaker, this is about frontline workers everywhere. That's why we're leading in doctors, leading Canada in registered nurses, leading Canada in health sciences professionals, Honourable Speaker. And we had the best record, Honourable Speaker, the best record by our healthcare professionals and the people of BC in addressing the COVID-19 pandemic.